because ultimately our goal is to serve the community. So we're really excited that we're finally opening our doors. We're operating Monday through Friday right now on the phase one from 8 a.m. to 8 p.m. The next phase will be to open 7 days a week, with basically the plan is to eventually go to phase 3, which is then to open our doors 24 hours. To really address those individuals that were going into crisis, having a behavioral health need, that were basically going into the emergency room. And we found that our law enforcement folks were having to sit with folks in the emergency room, bottlenecking their responsibilities in terms of going into the community. This program allows us to redirect those resources that were going into the emergency room into a more person-centered environment. Individuals who were going through a behavioral health crisis, to really get some personal one-on-one services and treatment to de-escalate, to redirect, to stabilize folks. It's a really more person-centered therapeutic environment where we really work on folks to address what's going on to get them back home. Ultimately, that's the goal.
So when you come in here, first of all, we have peer recovery specialists on site, so people with lived experience that can provide support to individuals throughout the course of their admission. On top of that, we have nurse practitioners on site who can do psychiatric evaluations and start medications. We're going to have a medication machine here on site so people can get really rapid access to those things that they may need. We can do individual and family therapy that's very brief and solution focused to try to help people before they move into potentially like a long-term outpatient therapy situation. We have a number of recreational type interventions. We can do games and puzzles. We purchased a Nintendo Switch so that we can encourage some behavioral activation with some of the sports games and dancing and things like that. We also have a sensory space where people can interact with a sensory machine, sand tray, weighted blankets, weighted stuffed animals, those kind of things for people that respond well to sensory intervention. In addition to the fact that we just have casual lounging spaces for people that may just need a rest or a little bit of a break from their stressors. And we have a number of clinicians on site to teach de-escalation strategies, education about maybe their mental health conditions and what may contribute to some of their symptoms, as well as whatever the local resources are that we're able to connect them with so that when they leave us, they have a very solid care plan for how to continue the stability that we've started while they were here.
And then the work happens afterwards, the follow-up, okay? Reaching out to you and saying, hey, did you fill your prescription? Hey, did you make that doctor's appointment? And if not, then we're here to coordinate to assist that person to do that.